Today's first panel will be more of a conversation in which our guests will discuss the importance of open science and open research, the open science and open research practices in neuroscience, but from the perspective of patients and researchers. They will also discuss how patients and researchers can and must work together. Please give a warm welcome to Madeleine Sharp from the Neuro and Benjamin Stecher, a patient's advocate who sits on several patients' advisory boards.
Welcome, everyone, and thank you for joining us this morning. My name is Madeleine Sharp, and I'll be moderating this session, which is titled Open Science and Conversation, Patients and Researchers Working Together to Open Neuroscience. So in this session, we're going to be talking about some of the ways in which patients and researchers can work together to improve neuroscience by making it more open and really by bringing the patient at the center of our endeavors. I'm joined today by Benjamin Stecher. Mr. Stecher is this tireless patient advocate. He was diagnosed with Parkinson's disease at the age of 29, and ever since he has been actively involved in Parkinson's disease knowledge dissemination and patient advocacy. He's the founder of Tomorrow Edition, which I think we may hear a little bit more about, where he reports on his conversations with leading researchers around the world. He's a patient advisor to the World Parkinson Congress, and he recently co-authored the book Brain Fables. We were also supposed to be joined today by Dr. Hilal Lashwell, who unfortunately, due to last-minute circumstances, was unable to join us. So just before we begin, I'm just going to give you the layout of how the session is going to work today. We're going to talk for about 20 minutes, and then we'll have a short question and answer period. To let you know how audience participation is going to work, well, there are a few key ways that you can give your input. The first is by, I think you'll see on your screen, there's a list of 4 topics, each assigned a number, and you can provide your input as to which topics you'd like us to cover at the end in the question and answer period by typing in the number corresponding to that topic. And you can also type in your questions directly, and we will do our best to address as many of the questions as possible towards the end. So, hello, Ben. Thank you for joining us today. Perhaps to begin, you could, I know from our previous conversations that you've been engaged with researchers, and I also know from your work that you've been engaged with research and with researchers for quite some time. And so maybe you could tell us a little bit about how that came about, how you developed these relationships over the last many years.
Sure. Well, it was a long, kind of hard road that I took. At the beginning of my journey here, I would probably send out about 10 emails to researchers trying to get some feedback on their research or try to get my foot in the door into what they were doing. And at the beginning, I probably got about 1 response for every 10 emails that I sent out. But over time, and with some persistence and some dogged determination, I slowly grew a reputation, I guess, in this field. I started interviewing a lot of them, and I got to the point where it was a lot easier for me to get access to the people that I wanted to access and to get an understanding of what they were working on. And that slowly grew, and I traveled around the world going from one lab to another. I probably visited, I lost track of how many labs I've been to and how many biotech centers I've gone to. But yeah, it's been a really engaging, really thrilling experience. I mean, the disease is something that no one would ever wish for upon themselves, but I wouldn't trade all of the things that I've experienced and all of the knowledge that I've gained as a result for anything in the world at this point.
And I mean, I guess what you're also kind of saying by describing your journey is that what you were looking for, you couldn't find, that already didn't exist, that kind of information?
Yeah, I really wanted to get a sense of what was on the bleeding edge, what were the best researchers in the world working on, and it was difficult to really gain access. I mean, the science papers, the journals that are out there, they're not geared towards the lay audience. They're only geared towards people who have a strong foundation in the biological sciences. And while that slowly developed for me over time, at the beginning it was particularly frustrating just to have that barrier placed in front of you, that there's all this information that's out there, but there's no way of actually attaining it and accessing it. It wasn't accessible to a lay person like myself at the time.
Okay. I think that brings us to the next thing that I wanted to address, which is since the topic of this conversation is open science, to maybe get your thoughts on what your perspective of open science is. And, you know, we don't have Hilal with us today, but maybe you could speak a bit to how, in your experience in conversing with researchers, how your perspective may be a bit different than the perspective of researchers on what open science is and should be.
Yeah, sure. So when I think about open science, it's really breaking down all the walls that separate the research communities from the patient communities, from the public and large, from research, from clinical science as well, and from everything that happens on a day-to-day basis. I mean, what I found to be the most kind of frustrating early on in my journey was just how many barriers there were in place between all these various communities, and how little was done to actually try to bridge those gaps. I can't tell you how many biotech centers, how many academic centers I went to or I spoke at where I was the first patient to even walk through their doors, let alone give talks to some of these centers. And I found that to be quite the shame, because I think there's a lot of reason to be optimistic about the future. I think there's a lot of good reason to be engaged in the scientific process, but patients often feel shut out from this whole community because of those barriers that are in place. And I think the science itself is hurt as a result. I think patients have a lot to teach scientists about what these diseases are and what we should be targeting, what we should be looking to treat. I often see researchers and scientists working on problems or working on questions that aren't a great concern for patients themselves. It's something that often we don't need as much help with as they think we do. I mean, there's some very simple things like in Parkinson's, for instance, all of the models that we have, a lot of the primary research goes into some of the core motor symptoms of this disease. And yet, if you talk to patients, if you get to know some of the people in the patient community, you'll see pretty quickly on that some of the non-motor symptoms are actually the most troublesome. And that it would be more in the public's interest and more in the patient's interest if researchers spent more time focusing on those non-motor symptoms and trying to understand them better, rather than just kind of narrowly focusing on the motor symptoms or what we see in this disease. So that's just one example of some of the things that I've come across that where I think patient engagement in the research process would do a lot more to speed up and direct research towards what's most needed in the public.
Okay, thanks. So you're kind of bringing up some pretty important structural changes that potentially need to be made in order to break down some of these barriers, or, kind of allow us to cross some of these walls. Have you, in your experience, you have a unique experience, you've traveled the world, you've spoken to researchers. What are ways, or have you seen people who have been able to kind of bridge these two worlds, the researcher world and the patient world, in a more systematic or structured way?
I have seen some patients who have made inroads in that direction. There are a few patients I know of who work in some of the pharma companies, who work in some of the patient organizations, but they're pretty rare. I still see most of the pharma companies that I deal with, most of the biotech companies in particular, and all of the academic centers, frankly, don't have regular systemized engagement with the patient community, with the people that they're trying to help. And they're often looking for ways that they can engage with the patient community a little bit more. With the pharma and with biotech centers, there's some regulatory issues that make it a little bit difficult for them to engage as readily as they'd like to. But I think with the academic centers, I don't think there's any reason why they shouldn't have more partnerships with their local patient communities. Patients should be regular visitors in their labs. I think it benefits not only the researchers and gives them that firsthand knowledge of what the patients are really going through, but it also helps the patients as well. I mean, it's kind of it really bolsters their spirits to see some of the hard work that's going on to try to address what's wrong with them, and really to see all of the people and all of the exciting and bleeding edge science. I mean, there's a lot of reason, like I said, to be optimistic about the future of science and of what's coming down the pipeline. But a lot of patients don't see that simply just because they're cut off from this world. It's not something that they know how to access, let alone have opportunities to regularly do so. So I just think that there'd be a lot more crosstalk and a lot of cross-cultural benefits if there's just more engagement between the two communities.
So I know that you are a patient advocate for the World Parkinson's Congress. How has that been for you? Has that, do you feel that, because the World Parkinson's Congress, as far as, kind of I'm aware in terms of congresses, is fairly unique because it brings patients and researchers and clinicians together. have you seen there that there have been some, as a result of this openness between these different kind of stakeholders and different groups, that there have been some interesting developments? And how have, what is that role of a patient advocate for the World Parkinson's Congress? How does that work?
Yeah, so I first attended the World Parkinson's Congress in 2016 in Portland. And it really, I was blown away by just all of the interactions that I saw. I mean, there's 3,000 people crammed into this one conference center. There's about 1,000 clinicians, 1,000 researchers, and 1,000 patients. And it was just a very educational experience for me in general, just seeing 1,000 patients walking around the hallways of this center, and you see basically 1,000 different versions of this disease. And then you see all the interactions that take place between the various communities. It really was inspiring to me, and it helped drive my focus in a lot of ways. And then I became more involved with the World Parkinson's Congress for the leading up to the last conference in Kyoto in 2019, where I gave a lot of talks and I took a more active role. And it was just a pleasurable experience to get to know a lot of the researchers that were working on the conference. I could see that a lot of the researchers that were engaged in the planning and in the development of this conference, they had a much more real sense of what the disease is that they're working on than the researchers that were less focused on engaging with the patient community. And the World Parkinson's Congress just gave a lot of opportunities for those communities to interact and to bridge some of those gaps. So I've just been very grateful for all the work that they've done, and I've tried to do what I can to help promote their work. And looking forward to their next conference in Barcelona in 2022.
I mean, some of what you're saying also brings up for me the sense that I get from working with patients that many people don't realize that there is a role for them to play in guiding research agendas. And is that the sense that you get with interacting with patients too, that they are amazed and surprised by how much you have been able to accomplish through your interactions with researchers, and that would be a possibility for them? Do you get the sense that there's a hunger on the part of patients to contribute in this way?
Definitely. I mean, I'm very much, I'm constantly motivated by the fact that I get letters from patients admiring how far I've come in my journey. Because I see for a lot of patients that they see the science community and they see that engagement with the researchers as almost this like insurmountable mountain that they can't cross. It's something that they feel like they don't have any access to. It's something that they feel like is a world beyond them, especially those who, I mean, it's been decades since they took any science lessons. It's been a long time since they studied anything that rigorously. It's hard for them they feel like it's just not something that's accessible to their point of view. And they also feel like they don't get a say in what's going on. They feel like passive recipients of the process rather than actively engaged members of the community. And I've seen all of the benefit that can come from people who make that switch, that take on the role of being an active member of the community. Not only does it help them spiritually deal with the problems that they have to face on a daily basis, but they do play an instrumental role in accelerating the research and making sure that the problems that they feel on a daily basis are being addressed. So just coming back, just hammering home that message that there's just so much that can be gained from some more interactions between the two communities.
So maybe, if you were to imagine your ideal world, in the way, I'll stick to academia because it's the part of research that I'm more familiar with, how would you envision an academic institute like ours, for instance, bringing in patients in a structured and regular way in terms of how they do science? What would that look like?
So I guess one of the best examples I've seen, and something that I've been happy to really be an active participant in, is here in Toronto at the University of Toronto. They've developed a patient advisory board. It's been going on for over a year now, and it's been a monthly meeting of all of the clinicians and some of the research staff and a select group of patients who discuss the problems that the clinic faces, discuss some of the research problems as well. And it's just been very motivating to see all of the clinicians there really actively listening and really taking into account what we have to say and letting us play a role in how the clinic is run and letting us play somewhat of a role in the research that goes on here at the Krembil Institute in Toronto. And I've seen all of the benefits that have been had from the patients that are involved as well. just feeling like we have a voice, feeling like we have an active say, and seeing tangible real world results happening as a result, and real changes happening in the clinic as a result of the input that we've given. So again, it's just one of those examples of how much benefit can be had from listening to the patient voice and developing a structured way in which patients can give back to the clinics that they're a part of and the researchers that help try to take care for them.
Maybe I'll bring you back to something you were mentioning earlier about your first experience going to the World Parkinson Congress, where you kind of became aware of all of the versions of Parkinson's disease that exist, so that heterogeneity. And I think that brings me to your book, also Brain Fables, which from what I understand kind of brings some of this up, but also addresses how this openness between patients and researchers and clinicians is important for bringing to the forefront some of these challenges that we have facing us in trying to understand diseases like Parkinson's disease. Could you elaborate a bit on what your book was about and on how you think open science is kind of at the center of understanding some of these challenges?
Yeah, and I have to give a lot of credit to my co-author of that book, Dr. Alberto Espe. He's somebody, and I've seen this in also the guest that we were supposed to be talking with as well, Professor Hilal Lachelle, those clinicians and those researchers that really look for input from their patients. They're really looking to learn. And it's that curiosity, that humbleness, that drive to understand what another human being is going through and what their patients are really experiencing and how to help them best, that I think has set them apart. And it's something that I was still constantly amazed by how much leeway Dr. Espe gave me in the crafting of that book and how much he was willing to listen and take on what I had to say. I think it really helped shape the narrative that we built together. I think it helped make it much more engaging, and I think it helped give a lot of color and flavor to all the stories that we told in the book and made it much more real. I think if it was just his kind of scientific examination of the field and just kind of his analysis of some of the wrong turns we've taken, it wouldn't have the same impact as it has now, that he's allowed me to bring in the patient story and give the patient input and give that perspective, because it makes everything that we do here much more real, much more tangible. I feel like a lot of the science and a lot of the research is separated in so many ways from the real life experiences of people. I mean, most of the research that gets done happens on lab mice or in cell cultures, where you have these homogeneous animals or these tiny cells in addition. And researchers have to strain to extrapolate what they're finding, how what they're finding actually translates to the real world. I think if you start from the real world and you start from that basis of this is what we have to deal with, rather than trying to work your way, rather than trying to bridge that enormous gap between what you see at a lab bench to the patient community, instead working your way backwards and thinking about how to deal with what the patients are experiencing on a daily basis, rather than how what you're finding actually translates to what the patients experience. I think that just grounds you, and it gives you such a much more solid foundation that has a much greater chance of translating to something that will actually benefit real people down the road.
So I think it would be nice to move on to the question and answer period, because I see a lot of questions coming in. But before I do that, Ben, do you have any final thoughts you want to leave the audience with about the role of open science and of kind of bringing patients at the center of that for research?
Yeah, I guess I would just give a personal PSA almost. If anybody needs any help out there, if any of the researchers there need any help engaging with the patient community, that's a lot of what I try to do. I try to bridge those gaps. I try to be a conduit for more engagement and more accessibility between the two communities. So yeah, just take advantage of me if you need it. If you need any help reaching the community of people that you're trying to reach, I'm more than happy to help. The other thing I would emphasize is that open science to me doesn't just mean opening up your research in a journal. It doesn't just mean publishing in open access journals. It also means making your research as accessible as possible. What that means, I think, is translating your work into language that any person can understand. It shouldn't just be at the level that academics can understand. I think some of the best work happens when researchers are forced to communicate their work to a lay audience. And what I would recommend, what I would hope, is that anytime you publish a paper, try and include at least a 1-paragraph summary written to an 8th grader or at the 8th grade level, so that I think it helps clarify not only for your audience what you're trying to communicate, but I think for yourself as well. It helps ground you in what actually translates to the real world.
Thank you, Ben. So the first question actually I'm gonna take from the audience, from an anonymous poster, relates to some of the points that you were just making now. So the question is, what suggestions do you have for, in quotation marks, regular patients who do not possess your gifts and initiatives to engage with open science? So, you were kind of giving an open call to researchers if they need help. What about on the patient end of things? How can patients kind of do, perhaps on a smaller scale, what you've been doing?
I guess part of it is the work of the foundations and some of the patient organizations as well, to make those bridges more accessible to patients of all walks of life. And then also, I guess, I think there's a lot of accessible material out there. I've tried to provide some through my website, but I think there's other websites that do an even better job of communicating some of the science in a way that anybody can understand. Because you do have to come to some understanding of what the researchers are working on. You do have to kind of, on some level, meet them halfway. A lot of the people in the scientific community, it's been a long time since they interacted with the lay audience. It can be intimidating even for them. And remember that for doctors and scientists as well, they're people just like anybody else. They have their lives, they have their focuses, yes, their careers are important to them, but it's just their careers. We're the ones living with this constantly 24/7. You can't expect somebody who doesn't have that constant daily grind to empathize with every single aspect of what you're going through and to be able to understand everything about the disease. But and I guess the other part of it is to realize how much of a hunger and appetite there is in the scientific community for more patient engagement. And that's part of what I've seen as well, is that they're very grateful and they're very thankful to have somebody that takes such an interest in their work and that is willing to engage with them. They also feel like they're disconnected. So I think they are open to bridging more of those gaps as well if somebody would just come and meet them halfway or just open those doors for them as well.
So it sounds like you're saying you've been really pleasantly surprised by the super positive reception you've received from anyone that you've reached out to.
For the most part, yes. I can't say that that's always the case, but for the most part, I would say, especially in McGill, I would say it's one of the places that I've seen the most enthusiasm and willingness to engage with the patient community and to bridge those gaps. You can't find it everywhere, but in a lot of places I found that there is that openness and enthusiasm for cross-talk.
Thanks. The next, there are a couple questions that I think are a little bit related. So one comes from Ted Fawn, who asks, what do you think is the biggest impact of open science for patients? And how can patients help accelerate the wider adoption of open science? And I guess here we're also broadening how what we're talking about in terms of open science. There's the kind of patient at the center of it, but also all of the sharing that happens as part of open science. Do you feel that there's some hesitation on the part of patients for some of what that entails? And how can we educate people to really get on board?
Yeah, it's kind of, on some level, it's a double-edged sword, because when you simplify information and you make it more accessible, it leads to people sometimes jumping to conclusions a little hastily. And it leads, I think, especially if you engage a lot of non-experts, and I've definitely am guilty of this myself, and I'm still guilty of this on sometimes a daily basis, of almost duping yourself into thinking that you know more than you do. Like you read a headline, you read a science article, and you think you understand it pretty well, and then you start translating it or telling other people about it, and that can lead sometimes to a false sense of hope arising as well. So it's very important that we balance hope with what's actually happening and the realities of how difficult and complex and challenging these diseases are. We want to make sure that everyone is grounded in as much factual information as possible. And it's kind of a weird tangent to go on, but I think it is important that we understand that this is a difficult process, that science does not happen at the snap of a finger, that experiments take a long time, because one thing I have noticed is that patients can get frustrated as well just by learning how difficult and how long it takes to translate something from the lab to the clinic. So we need to make sure that we're realistic in our expectations, and we have this understanding of how difficult the problems are, but at the same time realize that the greatest achievements, or our greatest desires, or our desire to cure and to treat these diseases better, is only going to come through more of this engagement from the two communities working as closely as possible together.
I think that brings us to one of the other questions that was asked by Annabelle Saylor, kind of about the education piece. So she asks, how have you been engaged in an innovative new curriculum to get to teach med students on better understanding the patient perspective? What has that experience taught you, and should these kinds of curriculums become more common?
Yeah, I actually think that patients should teach. Like every medical school should have a role for patients in their curriculum, in their teaching programs. I see medical students in particular, ones that often who are engaging with patients for the first time. They're amazed by the complexity of the disease. They're amazed by what it's like to actually live with these symptoms and these experiences day in, day out. It's something that you can't get from a textbook. You can't get it from listening to lectures. You have to see and on some level experience the real thing if you're going to understand what it is that you're actually grappling with and what you're dealing with. And then also it helps inspire them along the way. I mean, I proudly say that I've converted a couple medical school students to taking a more active interest in neurology in particular, neurodegenerative diseases specifically. But there's so much fascination with the brain. There's so much that we don't know, that we don't understand about why these symptoms arise, which I think, and there's so much just complexity there as well. While that can be challenging, it can be frustrating at times. For me, it's left me with a lot of awe and a lot of wonder as well, and something that I try to instill in the medical students that I teach and that I help guide along the way, is that the brain is just, it's everything that there is. It's everything that we know. It's everything that we are. It's the source of all of our greatest challenges. Something I often say is that I often wonder why we take more interest in stars that are 4 billion light years away than we do in the brain cells that make us who we are. And I think it's to some degree a shame that we understand stars 4 billion light years away much better than we do the cells that are responsible for every thought, every feeling, every emotion that we have. So I think it's just something that humanity as a whole needs to take a much more active interest in. And I think that those moments of interaction I've seen have helped inspire medical school students to see that challenge for what it is, and to take it up for themselves, and to realize that they can be a part of what I think is the most exciting field in all of human discovery right now.
Thank you. I think that that's a great point to end on, kind of inspiring us all to continue the work that we're doing in understanding Parkinson's disease, as well as a number of other disorders, and just brain function and the role that open science plays in all of this. So I think we've reached the end of our question and answer period. I want to thank you, Ben, for joining me today, and thank you, the audience, for your attendance and for all of your questions and your participation.